Hello, I'm Councilman Ron Bowen, and welcome to another edition of PSL Living, your chance to meet the people and places that make Port St. Lucie the unique place it is. And with me today are two special guests from the Hands Clinic of St. Lucie County. My first guest is Sydney Liebman, Director of Development, and also I have super volunteer Jennifer Strawn with me. Good morning, ladies.
Good morning.
Good morning.
Welcome to TV20 and Port St. Lucie Living.
Thank you for having us.
Thank you. The Hands Clinic, I became aware of the Hands Clinic in March when I attended a dinner, a fundraising dinner, and kind of a welcome back into the community dinner, and I was amazed by the work that the Hands Clinic does. It's a free health clinic for the uninsured in St. Lucie County, and it's just more than health care. They have a number of services, and they have quite an extensive organization, and again, we have some super volunteers that help with the organization. So with you, Sydney, first of all, the Hands Clinic, can you give us an overview of who it serves and what the purpose of the clinic is and the mission?
Absolutely. I'll start at the beginning. In 2006, when several members of the community decided that they wanted to start advocating for a free health care clinic in St. Lucie County. At the time, there were about 43,000 uninsured adults in the county. Today, believe it or not, there are over 65,000 uninsured adults. And I know a lot of people are thinking, well, how can that be? With the Affordable Care Act, why are there more uninsured people today than there were in 2010? And unfortunately, it's just the way that it is. There's a lot of part-time jobs, low wages here in this community, and so the number of folks that have become uninsured has grown in the community. So Hands offers primary health care, a continuum of health care for the folks that are diagnosed with a long-term disease. We're able to also get them care for those diseases. We offer vision care, dental care, we offer mental health services, we have a prescription program, we have ongoing educational classes, and we also have a pediatric dental program.
Well, and the unique thing about the whole organization, it's a not-for-profit organization, too.
Correct.
Serving the community. So any donations you get or any funding you get is tax-deductible and very scarce from what I understand.
Very
scarce. You and I talked about that.
Yes, this year we are in a little bit of a transition. We knew that our funding from the state and federal lines was going to be cut. What we didn't anticipate is that it would disappear. And so this year our funding has disappeared right now. And so we are scrambling to make that up and become self-sufficient in whatever way that we can, so that we can keep on providing services to the possible 65,000 uninsured folks who would possibly qualify for services through us. Right now we serve about 3,500 patients.
Wow, that's an incredible number. And
yes.
You do it, again, a volunteer army of volunteers, doctors, dentists. Talk about those people that are involved.
An army is a good way to put it, because all of our doctors, all of our dentists, all of our physician services, nurses, they all volunteer their time. We have 2 nurse practitioners that are on staff, so that we always have someone there and we don't have to worry too much about a volunteer schedule. But all of our physicians, our dentists, all of them come in and volunteer their time, and we are so grateful for everything that they do for the clinic.
It's got to be quite rewarding too when you take a young child, for example, who's sick, and you're able to treat him and get him back in good health, or even an elderly person who somehow has fallen through the cracks, get them the care they need.
We don't actually serve children. We serve only adults, but that's
right.
okay. But it is. We've had so many patients come back in and tell us that they no longer need our services because we made them healthy, and so now they're able to find a job and get back out there in the market, so to speak. And then they come back and they tell us their success story. Many times it's because of dental work. Many times they've come in with such dental problems that they can't get a job because they don't have any teeth. And so we've been able to turn so many lives around, and then they don't need our services anymore. Nothing is more rewarding.
Yeah, I'm sure of that. And you and I talked briefly, and I do want to get to with our other guests. We talked about preventive care or nipping it in the bud versus going to the emergency room for treatment, which most people would do in certain circumstances.
It is amazing how much money can be saved if folks will go ahead and come on into the clinic as opposed to using the emergency room as their primary care. And as we have learned, those that are uninsured end up using the emergency room for their primary care, and we all know that really isn't the place to go for primary care. The average cost of an emergency room visit in St. Lucie County is about $5,500. So in the 4 years that the clinic has been in existence, which is a very short period of time, we're still a baby, but we've had 18,000 patient visits in those 4 years.
Wow.
Had those 18,000 visits been to an emergency room, that would have come to $99 million worth of uncompensated care that the hospitals would have had to eat. And we all know the hospitals aren't really going to eat all of that. So a lot of that, a good portion of that, is passed on to those of us who are insured, or it's passed on to those of us who do have to go to the hospital by way of higher hospital rates. So our hospital rates go up, our insurance premiums go up, and so the clinic has been able to take care of $99 million worth of uncompensated care.
Wow, and it's in a 4-year period, and it's done primarily through volunteers, and that's my next guest, Jennifer Strawn. Jennifer, welcome to TV20, and it's people like yourself and your husband, Dr. Strawn, that do the dental clinic. Explain about that to us.
Oh, well, we couldn't have done it, obviously, without Sydney, so I just wanted to say that, and I'm just one of many volunteers at HANDS, but thank you for the kind words. Yes, Jim had a vision many moons ago about needing more dental care in the community, and so he went to the health department first and started his journey there, and then when the health department was up and going, then he went over to HANDS, and that's where he began the dental department over at HANDS.
Well, you've been kind of a team. You shared that with me. You and your husband have both been in the community. Talk about what you've done with other dentists, the interactions and the networking you've done with other dentists in the community.
Well, the Julia project that began with Wendy Dwyer reading the book called The Necklace is where this all kind of stemmed from. And then between Wendy and Sydney coming up with this project that has just been outstanding, it's based on women coming together to get a necklace that they wouldn't have otherwise been able to get on their own. And the story entails a lot of love, friendship, a little bit of, bad things that come along with it, but that's the premise for the whole story behind the necklace. So G. Allen's Fine Jewelry volunteered or donated the necklace, which is this necklace, for us to have. 13 women share it among 13 months. And what we do is we go out in the community. It gives us a platform to go into different offices. We say that we will raise X amount of dollars for our month of having it. July was my month to have it. Being married to Jim, I thought, well, okay, this is a perfect way to get in to talk to dentists. And then hopefully Sydney can come in and talk to dentists, and we can try to get more volunteer dentists into the clinic. And I know there's always a shortage of need. Obviously, get more volunteers in, and then I think that they may have some money to give as well. So we reached out to over 135 dentists, either by mail or by phone contact. We went in to visit over 40 dentists. We had the girls in the office kind of tag with me along. And we have to date 17 dentists that have agreed to donate. Jim set out a challenge. It's 1% of their earnings, their July earnings, hopefully $1,000 each. There's some of those dentists who said that they're not going to do that, but they will donate somehow. So we're hoping to raise $20,000 in July. So fingers crossed, we're going to see where we're at with 17 dentists. Well, we'll see what we're doing with that.
I think Sydney hit it right on the head, and both of you hit it on the head. That you kind of forget how important dental care is, too. I mean, medical care is important, but we don't put the dental care in there with it. But again, if you have dental disease, periodontal disease, or just bad-looking teeth, or need extractions, I can see where the dental clinic would really help a lot of people with their self-esteem and their problems, pains, aches, and pains.
Dental disease leads to heart disease.
Right.
Did not know that.
Many people don't know that. Many
not know
people
that.
don't know that. So, I mean, it has to be handled. And I believe, just from what I'm witnessing at the clinic, these past 7 months, I believe it's a huge reason why so many folks are unemployed, because all of these folks come in and they say they haven't smiled in 4 years, or I haven't smiled since I was 20, or, you know, and then they show us a picture where we had one woman who showed us a picture of herself that she had taken a white piece of paper and put it in her mouth so that when she smiled for that particular photograph, it looked like she had teeth.
Wow.
Now she has a full set of dentures, and she never takes that smile off her face. So it's amazing. We have 9 dentists right now that volunteer their time with us on Fridays, and so they rotate. Usually there's 2 in there at a time. We have 4 dental operatories, and so we're able to put 2 dentists in at a time. And this past Friday, we served 17 patients at one time, and so that was phenomenal. It was a phenomenal day. We have about 500 people on a waiting list for dental care.
Man, you guys are making me, I'm amazed. And again, I knew about the medical end from March, but again, the dental end is really filling in the blanks in my mind. Again, I can't believe the impact, and I've much appreciated the impact you're having in the community. And I want to be able to help you. I'm sure the people in Port St. Lucie want to help that are watching this program right now. So how do the people get involved? Jennifer, are retired dentists and retired physicians welcome to volunteer time? Or?
Absolutely. We have one volunteer dentist now, and his mind is drawing a blank on me. Do you remember his name by chance?
Who's retired?
Right.
Gosh, I don't know.
We do have one now, and then one of the volunteered or retired dentists now who donated money is Dr. Deary. So just because you're retired, you're more than welcome to come in and volunteer your time if you're still licensed. And then, of course, if you want to come in and volunteer your skills, as long as you're licensed, and of course, money is always accepted.
Yeah, so. Definitely. And the nurses too, and doctors, physicians?
Nurses, especially hygienists, if they want to come in. If you're an assistant and would like to come in and volunteer your time, there's always a need for help at Hands, as far as I know. So.
And there's a lot of fundraising opportunities with Hands, with the necklace, if somebody wants to get involved with the necklace.
There is, and let me just tell you, some of the feelings that have come along with wearing Julia, I never ever expected, and I'm so grateful for the opportunity and to have been involved in this. Not only the group of women that I'm surrounded with and getting to know Sydney a little bit better, but just the feeling of this necklace. She's truly a person of her own. She has her own Facebook page. It's JEWELIA, so I encourage you to go on and read the stories and see the pictures of where she's traveled to, the people who have worn her. But you get this feeling before you get Julia. It's a little bit of anticipation, excitement. You're wondering how beautiful she is. It's your turn to wear her for the month. You plan what you're going to do, and then you get her and you put her on, and you're going to wear her for the month, and you get out on your adventure. And as you're wearing her, you feel this sense of power, and you feel a little bit invincible, which is good because you're asking people for a lot of money. So it's a little bit good that you have this guard over you. And so as you're feeling invincible and you're out there, this awareness comes over you, and the awareness is, oh wow, this is what I'm in. Because you're listening to Sydney as she's in these offices with you, is what we did. We've gone to different offices, and she's educated the community on what Hands is, because there's so many people who still don't know what Hands is. And she's educating them on what the needs of our community are, and it's staggering when you hear how many people are truly not being helped in our community. So the awareness kicks in on how much work is still left to be done out there. So you kind of feel this pressure of, okay, I have how many days left? I still can do more. There's still all these people that I still can reach. So the awareness kicks in, the fight kicks in of, I've got 4 days left, I can still reach 4 more dentists to make my 20. It's just this incredible feeling, and it's something that I'm very, very proud to have been a part of.
Well, I'm very proud to have both of you on as guests, and I'm very proud of the work the Hands Clinic's doing. And I hope that the people watching this program will volunteer time or write a check out as a tax-deductible donation and keep this free healthcare clinic going. Again, it's more than just healthcare; it's dental care, vision care, and a number of other services. So hopefully they'll look up the Hands website or follow the number on the screen and get involved with you. But I want to thank both of you for being here, taking time out of your busy schedule, and again, telling a great story about a great organization, the Hands Clinic.
Thank you, Ron.
Thank you.
We'll be right back after these important messages.